My name is Yvonne, and I belong to Waco Church of Living God, Waco, Texas. Pastor Sean Brinson. I was asked by Pastor Brinson to give an educational session regarding COVID-19, coronavirus 2019, also known as COVID-19. So, what is coronavirus? Also known as COVID-19. It is a viral respiratory illness caused by a new coronavirus. As we know, there's many strains of the coronavirus. It is a large family of viruses that has been found in people and also in different species such as animals, including camels, cattle, cats, and also bats. COVID-19 was first reported in Wuhan, China, which is a city in China, approximately around November 2019, which spread it very rapidly, and it was declared a pandemic on March 11, 2019. So incubation, as far as COVID, approximately 5 days. It can also take 2 to 14 days to range, and that is based on SARS and the MERS. And all of this information is also coming from the Center of Disease Control and Prevention, also known as CDC. Many people have been required hospitalization due to this virus. And again, the data is constantly changing on that. Symptoms can worsen within that second week of having the virus. Symptoms are similar to the flu, influenza, and also that of the common cold. So quarantine and isolation. Oh, also I wanted to let you know that some people ask me all the time where I'm seeing different data. You do see different data, and that's because the data is being updated at different times. So, and there's several sources that are collecting this data, so it's kind of trending and then updated at different times. So what is quarantine and isolation? And I do have some stats here, but I'll go back to all that. So quarantine, the difference between quarantine and isolation, if you're quarantining, you are wanting to keep, you have evidently been exposed by someone, family member, coworker, whoever that may be. And so you're wanting to isolate yourself, quarantine yourself to decrease that exposure. Quarantine helps to prevent the spread of the disease, and it can also occur before a person even knows that they're sick. So if you've been exposed, you may not have symptoms, you may not be sick. Quarantine yourself, stay at home, don't go to work, don't expose others. People in quarantine should first stay at home, separate themselves from others. You should also monitor your health, and you should also follow directions from your state or local health departments. So isolation. If you're told to isolate, you have evidently been diagnosed with the virus. So isolating yourself, you want to separate the infected person, that person that has been diagnosed with COVID-19, whether they have symptoms or no symptoms, you want to isolate that person. People who are in isolation should also stay at home until it's safe for them to be around others. If you're at home, you want to stay in, I'm going to call it a sick room or a little private area, man cave, whatever that may be. You want to isolate yourself from other members of your family because you don't want to expose them to the virus. So you can stay in the same home, but you do want to isolate as much as possible, even if that means using a different bathroom if that's available. Not always available, but if it is. So both quarantine and isolation, they can protect the public. It involves in protecting the public. It helps to prevent the it helps limit further spread of the virus. And also, this can be done voluntarily. Nobody has to tell you to quarantine. You will most likely be told to isolate if you're diagnosed with the virus, but nobody has to tell you to quarantine. That's something you should do voluntarily if you feel like you've been exposed or feel like you can expose others. That's being symptomatic or asymptomatic. Asymptomatic meaning no symptoms, symptomatic meaning you do have symptoms of common cold or influenza, cough, fever, sometimes a rash, and so forth. So individuals that need to take extra precautions. Who are those individuals? So individuals that are needed to take extra precautions are those that are immunocompromised. Those have other comorbidities such as diabetes, hypertension, cardiovascular diseases. Those are all asthma, HIV, anything that causes immune cause you to be immune compromised. You need to take extra precautions. Also, other populations that need to take precautions, those that have dementia, other disabilities, pregnant moms or people that are breastfeeding, homeless, extra precautions, facial and minority groups. It has been said, and I do not have the extra research on that. I do apologize, but that African Americans tend to be more prone. So just keep that in mind. There is no specific treatment for this virus that we know of as of right now. Healthcare professionals are trying hard to educate themselves and do the research to educate the public, but as of right now, there are no treatments, and they are also wanting you to avoid steroids. Moving on, well, I want to talk more about those who are at a greater risk. So if you are at a greater risk, there are precautions that you can take. I do know that grocery stores are allowing the elderly to come in first, and this has all probably changed a little bit since we opened up, but please be mindful that we still need to take precautions. The virus is still out there. We have done nothing to cure it, and we do not have a vaccine, so please take precautions. But if you are at a higher risk, I would like to extend that you get extra prescriptions, get more than a 2-week supply, or at least a 2-week supply of your medications. You talk with your healthcare provider about other vaccines that can be provided to you to help control the spread of this virus, such as pneumonia, flu vaccine, and so forth. You want to delay getting care for your underlying conditions, and you also want to stay in close contact with your healthcare provider. In the need that you have any difficulty breathing, or just say you have asthma and you notice that there's changes in your breathing, seek medical attention immediately, meaning call 911. Okay, so what can you do if you are sick? If you are sick, you can stay home. Running to the ER is not the best solution. More germs, that's where the infection could most likely be. So if you feel like you have a fever, cough, or symptoms that may be related to COVID-19, most of the people usually have mild symptoms. Mild symptoms meaning you have a cough, maybe a mild cough, or you have a low-grade fever. Take you some acetaminophen, which is also Tylenol, if not contraindicated with your provider. Always check with your provider before doing anything, taking any type of medications. Please check with your providers. I am not a provider. I cannot tell you to take Tylenol, but if it is permitted, please take Tylenol to control your fever. Make sure you're using good hand washing to prevent covering your mouth. When I say cover your mouth, you don't want to cough directly into your hand, maybe on your inner part of your arm, but I would say keep I don't have any tissues, but you know what tissues are, Kleenex. Keep your Kleenex and maybe use that. I am wearing my mask. I have it off because I am talking. I would like you guys to understand me. But I do have my mask. And while I'm speaking of masks, I also want to share with you that I have been seeing a lot of people. I touch my mask from the inside. I'm not saying that that's the best thing to do, but I do know that, and I'm going to do this, but I'm going to clean my hands, touching it on this side. This is the nastiest part of your mask, the outside, okay? So you don't want to keep doing this, talking. We can't breathe, pulling it down because we can't breathe. But if you're grabbing it here, you're contaminating your hands. So if you're not going to wash your hands, then you're causing the chance of a spread. So just be mindful of that. So I'm going to take that back off. Okay, so let's see, steps. Where was I? I told you that if you have have a cough, fever, cough, or symptoms that you might have COVID. You could be positive. Most people do have mild symptoms and they are able to recover at home. So know that you can recover at home, but you do want to communicate with your healthcare provider. You want to keep track of your symptoms. Get your journal, document, keep up with your temperature. I would say take your temperature at least 3 times a day, minimum. But you do want to take your temperature. You want to document that, and then you can share that information with your provider. You can also tell if symptoms are getting better or if they're getting worse. If you have an emergency, again, emergency meaning airway, breathing, circulation. If you cannot breathe, I repeat, please report to your nearest ER or call 911. A wise thing to do if you're going to do that, hopefully you have a family member with you and they can call, if you're going to drive, they can call 911, not 911, they can call the local hospital and let them know that you're coming, possibility of active COVID case, and therefore they can take other precautions as well. So again, steps to prevent COVID-19. If you are sick, you want to stay at home except for getting medical care. You want to take care of yourself. That means getting rest, staying hydrated, taking your over-the-counter medications such as your Tylenol, things that can help you feel better. You want to talk to your doctor, and you want to avoid public transportation. And you want to try to stay as active as you can. I understand that when you're sick, you don't feel good, you don't want to move around, but I think it's very important that you stay active as possible within your home, within your little isolation area. You want to separate yourself from others, and again, like I said, you want to monitor those symptoms and avoid things like this. Is something that a lot of people don't think about. But if you're sick, you want to avoid sharing household items such as dishes, drinking glasses, cups, eating utensils. You just want to So again, that personal equipment is very important. Using your mask, using your hand sanitizer, any brand. I think they're wanting it more than 60%, if I'm not mistaken. This is 70%. So the higher, I think, the better. Your Lysol if you're sick. Doesn't matter which brand. If you can find it, there's different brands, but these are just examples of things that you can use. Spray into the atmosphere, the air. Also, you can spray it on surfaces. It's good to spray on doorknobs and handles. And another thing to do, wipe off your doorknobs, your handles, your sinks, and just good home hygiene is also important. So let's talk about testing. So who should be tested? If you think that you've been exposed or you have COVID-19, please contact your provider. A lot of people don't have providers. There are testing centers. You can look that up on the CDC website as far as, and also the health department website, but there are other places that do testing. I apologize for this phone. So there's two kinds of tests that are available. There's a viral test and also antibodies test. Most people are going to get the viral test where they swab you and kind of go deep into that nasal cavity. A little uncomfortable, but it's doable. I've had it done. It's doable. And then the antibodies test. It has been known that tests are limited. So if you can stay at home and monitor your symptoms at home, please do so. If you feel like you need testing, please contact your provider, and hopefully they can get you in the right direction to get tested. Testing usually takes 1 to 3 days to be confirmed. Some are even within minutes. So, when can you be around others after you've likely had COVID-19? So they're saying once you're asymptomatic and afebrile, which means no fever for at least 3 days,
and your symptoms are improved, 10 days since your first appeared symptom. That could be different from providers. Some people say 14 days, so check with your provider. I'm just giving you the information that is coming from the CDC website. Ways to stop. Let's talk about children and COVID. So children are at home. They're getting a little anxious and bored, just like most adults are, with this, 8 to 10 week quarantine that most people have been doing. So things to do, tips to help protect your children. You want to educate your children, of course, on hand washing. You want to educate them on coughing and covering their mouth. If they don't feel good, you want to let them know, educate them on letting you know so that you can take the proper precautions or steps to get them treated. Teaching them to keep their hands clean often, avoiding people that are sick, social distancing. That's 6 feet, arm length, however you want to put it. But please teach your children to keep arm length or 6 feet when they're around others, even around other children. Those children that are 2 years and younger, it's okay for them to wear a mask. It's okay. The mask is not so much for you, but also to help keep those others from getting sick. Those that we don't know that have those comorbidities and other underlying conditions. Washing your clothes, laundry, taking your clothes off. I'm in the healthcare field, so as soon as I walk through my door, everything's coming off, shoes and all, and it's going into the wash machine. So you're your first line of defense, so take care of yourself first. But again, limiting your children time with other children. I know it sounds harsh, but during this time, we have to do that. We have to do that. So keeping them busy, keeping them with things that they can, learning activities. There's other ways that you can do. This is a good time to do bonding. I say bond with your families during this time. Animals, those that have animals. I want to speak on that because I have a animal, a pet. Taking care of your pets, making sure they're getting vaccine, making sure that you're keeping them in the house, you're not taking them out in public. They don't need to go out in public right now. Keep them at home as much as possible, and make sure that you're keeping them up to date with their pet visits and vaccines. Because we do know that this virus is from an animal source, so you want to take care of those pets. Also, traveling. Traveling is not recommended right now. A lot of traveling has been banned, so just keep that in mind. You want to check with the websites to make sure that you can travel and what are the protocols that they're adding for when you're traveling, so that you don't get turned around and cause delays in that. Again, wearing your mask when you're traveling, keeping that social distancing. That's the main part. This mask that nobody likes to wear, but I'm telling you, it's a good preventative. Washing those hands, minimum of 20 seconds. Sing a happy birthday song, whatever you have to do, but make sure you're washing your hands frequently. When you're washing your hands, think about those areas, those rings that you may need to take off, put them in your pocket, whatever you have to do, but get those areas that are missed in the hands, such as, and I wish I had some visuals that I would have brought, but just keep in mind the areas that you miss when washing your hands to help prevent spreading the disease. One last subject that I'm going to talk about before I go is funerals. And, we've all lost a lot of people. I've lost someone very dear to me, so this is very personal for me. We're not able to grieve the way we're normally used to grieving. We're not able to provide that support that we're used to providing during our time of need. So just understand that this is the way it is right now, and maintain that social distance when you're going to funerals. Make sure that you can still provide support. Social media is wonderful, virtually, whatever you have to do, but just know that we have to take these precautions, and especially during times when we're at funerals, to maintain that social distance. At funerals we want to hug, we want to, you know, give that support, and now's not the time to do all that. We have to give virtual hugs at this time. Um, so let's see, that's about it. So we do know that COVID-19 is a pandemic. This is a very serious global health threat. And the CDC is working, in my opinion, very hard to get things under control and help us globally. We must do our parts. And when I say do our part, again, masking up, gloving up, whatever you want to do, hand washing. And if you're going to wear gloves, be mindful and change those gloves periodically. You're going to places and you see people wearing their gloves. Yes, they're trying to protect themselves, but guess what? You're grabbing my card, you're giving me my card back, you're grabbing the next person's card. So that can be a transmission spread. So just be mindful of the little things that we have not been used to being mindful of. And try to take the appropriate precautions to prevent the spread of COVID-19. And again, this is a human-to-human transmission, so social distancing is important. You want to comply with your state and federal regulations. I can't stress enough about social distancing, proper hand washing, infection control, again, mask and staying at home if you feel like you're sick. That's all I have. Hopefully you have more reinforcement as far as COVID-19. I did not give any statistics on the deaths, but I do know that there's been more than 5 million cases and more than 300 plus deaths here in the U.S. So it's serious. It's not over. We have a long way to go, but we are our first line of defense. And again, I would like to thank Pastor Brinson for giving me this